Right. Yeah, that's good.
Like that.
Bado? Alright, just do one, two, three, one, two, three, so you can take your sound.
1, 2, 3. 1, 1, 2, 3. 1, 2, 3. 1, 2, 3. Is my hair okay, you guys?
Yeah, your hair looks great actually. I love the color. Welcome back to the Weekend Express. We're glad you're watching. Now, this week, Kenya joined the rest of the world in commemorating the World Breastfeeding Week, an annual observance to highlight the benefits of breastfeeding to both mothers and children. And joining me in studio now is expert nutritionist Dorcas Gishuhi from the Nairobi Hospital to give us more insight on breastfeeding and especially the nutrition aspect of it. Dorcas, thank you so much for joining us in studio this morning.
Thank you so much for having me.
Right. So the world has been commemorating the World Breastfeeding Week, and this happens every year just to bring more sensitization to the effects of breastfeeding, the importance of breastfeeding to begin with. So let's begin with the health outcomes for a mother who breastfeeds their children for 6 months and more, as the World Health Organization prescribes. What are the health outcomes for that child?
Thank you so much. I love breastfeeding as a topic. And for today, I would want us to encourage every mother out there that they need to breastfeed a child despite the challenges that they could be having.
Right.
The benefits are many because they are both benefits for the mother and benefits for the child in terms of health outcomes. And when you look at the child, you're thinking of how is the immunity of that child, because children are generally born with a low immunity. And as they develop or as they are growing up, you find that the immunity is something that develops with age. Yeah? So a child who's breastfed, the benefits of breastfeeding is the breast milk itself has components that are able to enhance the immunity of that child. So they have lesser outcomes in terms of going to the hospital for maybe most of them, because the challenges that children will have are respiratory infections. They will have GIT problems like diarrhea. So you have a child that has been breastfed, the immunity is better, they have less visits to the hospital, and the child is able to sort of have a very mature gut as they are growing up. And all these things have a way of alienating allergies for that child because the immunity is stronger. And when you're thinking of the mother, you're thinking of how if a mother has breastfed, in terms of research has shown that breast milk, the breastfeeding technique for the mother, they are able to have reduced incidences of breast cancer. They are able to lose their weight better because you find that even the weight management is a challenge for our country because that weight is what is giving us so many of the lifestyle conditions. Yeah, so we have both benefits for the mother and for the child.
All right, so let's talk about the negative effects then for a child who is either not breastfed at all or not breastfed enough.
So we could say, what is enough breastfeeding? Yeah, we need to breastfeed our children for 6 months. And we normally use a term that is exclusive breastfeeding.
Right.
That means that that child will not have anything else except for the breast milk. It is not water or maybe medication that would be prescribed by the doctor. So anything that is out of the breast milk is not considered important for the first 6 months. So a child who has breastfed for 6 months, they have optimal benefit from the breast milk. So if you're thinking of those children who have not been adequately breastfed, then the immunity tends to be lower. The mother is able to have as many, the hospital visits tend to increase. The physical development of the child is affected. You're thinking of the milestone of that child. At 6 months, maybe they're supposed to crawl. At 9 months, they're supposed to try and stand with support. So those are challenges that those children who have not been adequately breastfed tend to have.
Right.
So they have delayed milestones generally in terms of physical development. There is also an aspect of cognitive development, which is more of intellectual behavior of the child. We find that breast milk has components that are able to really boost the brain development of the child. And if they have not been breastfed adequately, then in terms of how they absorb or how they get into the society and have learning skills, they tend to have delayed of all that. Yes.
All right. Expert nutritionist Dorcas Kishuhi from the Nairobi Hospital with us in studio, giving us more insight onto the benefits of breastfeeding. Do feel free to share your comments and questions with us under the hashtag Weekend Express at KTN News, or tweet me directly at Michelle Ngela. You can also call in using the numbers on your screen and ask any question you'd like. So, Dorcas, like you say, so many benefits as well as, health implications if children are not breastfed enough. But let's speak about women who are just not able to breastfeed because they don't have enough milk. So they resort to either just cow milk or using the formula. How would you advise them, because they don't have any milk?
Okay, we could start with how you get to not have enough milk.
Right.
We have different women. We have women of the high socioeconomic status. We have women that are do not have those kind of challenges that they have to resume to work after 3 months. Because you find that once you're away from your baby, the flow of your breast milk is not the same. Because there are not those stimulus because when you have your baby with you, there's a lot of stimuli in terms of milk production. So we really need to support the mother who especially is resuming work after 3 months, because then if they're able to be taught how to express milk, because that improves the continual production of breast milk, then that mother is able to not have reduced milk eventually. So I think what would really help is that we really make sure that they don't have reduced flow by supporting them on how they can be able to still resume work and still have continue with breastfeeding for the 6 months. So one of the support we give is when they are coming for from the hospital, we have a postnatal clinic. So when they are coming back, we want to teach them how to express milk, how to store, the best methods of storage, because you find that there is a way you can store milk and it would last longer.
Several days.
Yeah, several days, even months. Because the temperatures,
Wow.
because the temperature of the milk and the temperatures you're storing the milk is what determines how long it can last. Yeah, so we really need to teach them, the woman, how to store that so that they're able to keep, even if they have resumed work, they're able to express and they can be able to store in the best appropriate methods. The other things that we can do for a mother who has, they could be, we really need to know also, are they having medication that they are using that could be affecting the flow of the medication, of the breast milk, So, and once you find the root cause of the reason why they're having a reduced flow, then you're able to address the problem better. Yeah, but
so that's something that can be reversed.
It is something that we can actually reverse. Yeah, because what happens is you find the principle of production of breast milk is a supply demand kind of a relationship. So if the supply is low, then you find that the demand is low, then the supply tends to really slow down.
All right. And even as we ask for comments from our viewers, we did ask for a few questions since last night, and some of the questions that they are asking, one of them here is asking, when do you begin breastfeeding your baby after birth? Is it a day after? Is it immediately after you give birth? So when do you start breastfeeding?
It's recommended that if you really want to sustain the flow of breast milk, that it is after you deliver immediately, that within the first 30 minutes you should have initiated breastfeeding.
Right.
So what will happen is once you start breastfeeding, the flow of the milk is not immediate. It is normally gradual. So you find that the benefits of breast milk are also from initial stages of the milk that you're able to produce initially has the best benefit in terms of immunity. So the mother who breastfeeds immediately after 30 minutes of delivery, they are able to give the baby the best of the outcome. Then if you delay after an hour, after 1 day, because of maybe one reason or another, then you find that that child may not get all the benefits from the breast milk, and you also find that your flow does not also cumulatively increase. Yeah.
Right.
So it's
Another one here is asking, my baby has refused the breast. How do I go about this?
It's important that we know it's a technique to breastfeed. There is a way you latch your baby. There is a way you support your baby when you're breastfeeding. If the baby is not well supported, they tend to refuse to breastfeed.
Because they're not comfortable.
Because they are not comfortable. There is a way the baby is able to suckle. So you find that if they are also not able to be supported and latched the way it's supposed to, the suckling process does not flow as it should be. And when the suckling, when they have not latched well, the flow of the milk is also not as expected. So the baby tends to tire faster, and they are also not full because there was no that flow that was expected.
Right.
So we really need to teach the mother, who is a new mother especially, how do they breastfeed. It is not something that you learn with time. That's something that we need to know. It is something that you really need to be taught. How do you support your baby? Depending on all the situations, there are mothers who have given birth a normal delivery. There are mothers who have given birth as a CS. So there are different methods of supporting the baby, and those are things that can be done.
Right.
Yeah.
Right. And so in many cases when the baby refuses the breast, mothers resort to the bottle. Is that recommended?
Not really. I would say yes. I would say it's not recommended. Reason being because it tends to keep the baby away from the breast milk.
Right.
Yeah. So it's not something that tends to bring the baby closer. And then what happens with most of the bottles, it's very easy for the flow of the milk from the bottle than it is from the breast. So they tend to feel that breastfeeding is more tiresome,
Right.
and they will keep rejecting the breast milk. And then you realize, because you're supposed to, the more you breastfeed to the breast, the baby is able, your flow is better,
Right.
than when you're trying to do an express. Yeah.
All right. So we have an interesting comment here from one of our viewers who was saying, breastfeeding is not something I would recommend for myself because it will make my breasts sag and look ugly and unattractive. So are these some of the reasons you get from women as to why they don't want to breastfeed? And is that true, that it results in, sagging of the breasts?
It's not true. Most women are afraid of the body image. I've come across several of those women, and it's very difficult to try and encourage that kind of a person,
Right.
because they already have a perception of how it will be after they have breastfed. But I think what normally we would want to emphasize is, what are the benefits when you breastfeed? Because the benefits when you breastfeed and when you try and express milk are totally different.
Right.
We also try to encourage that mother that it is not an eventual that would happen. So it's important that you think of the baby, what you're giving your baby, the benefits you're giving to your baby, and also to yourself in terms, because what happens is also, the more you're able to produce breast milk, you don't have problems of hormonal imbalances, those things that we tend to have as an outcome later in life.
Right.
Yeah, so it's important that the mother, what we will do is we want to encourage the mother on what are the benefits if they breastfeed. So that once you don't really restrict yourself to thinking of the body image, you're able to think of the better outcomes that could be there, and you're more encouraged to try to breastfeed.
Right.
Yeah.
Now talk to us more about the mothers who don't breastfeed and the fact that they're more prone to ovarian and breast cancers. Talk to us about that, because I feel like many people are not aware of that fact.
Yeah. Yeah, it's important that we know that once you don't, the body has a way of, once if you're a woman, once you have given birth, your body ultimately will produce milk. That's the first nature cause. So what happens is this milk has to be released. So if the milk tends to remain and it accumulates over time, there is what we call engorgement of the breast. So that causes a lot of infection over time, and
Right.
those cells tend to be affected. The cells that are that form the breast itself tend to be affected. So over time you'll find that mother, because the cells are not healthy as they should be, there are chances of having, they could be cancerous, but most of them are malignants that could end up being cancerous. So most of them, the chances are, if you don't breastfeed, or if you don't give birth to a child, because the other outcome is the ovarian cyst. If you don't give birth to a child, then you find that all those complications, because it's a normal course of nature. If those things don't happen, the body has a way of trying to rejuvenate and try to adapt to the situations that you have given itself. And because they're not the best situation, those outcomes that are not the best would eventually happen.
Yeah. Okay. And so during breastfeeding, many mothers don't know when their baby has had enough milk. And so could underfeeding the baby also result into the same implications as not breastfeeding the baby?
It could be, but there are signs of, you can't be able to tell the baby if they're getting enough. There are signs when you're breastfeeding that we will teach the mother, that they need to know that how often should a child urinate, how many diapers should the mother change, let's say. How often is the child crying? Are they irritable after they have breastfed?
Right.
Because you find that there are children who will be breastfed, but immediately after a breastfed or after a breastfeed, they are more irritable than they were before. So you find that there are small signs, a few signs like how comfortable is the child after they have been breastfed, how often are they passing urine, how often is the mother able to breastfeed, how long does the child sleep after you have breastfed them, because if they have short intervals of sleep and then they wake up, they are more irritable, you tend to end up, you can conclude that the child is not having enough. But if your child does not have such kind of symptoms, then you could be comfortable that they're having enough. When you are doing the weight monitoring clinics, once the baby has your baby is born, you do monitoring every month. That's what we encourage. So there is a target that we give a child every month. So if you come to the clinic and you're doing the follow-ups as they are expected, we are able to pick a child who has not breastfed for the last month adequately.
Right.
So those few signs and many other more that we will tell the mother, they are able to give them the comfort and the reassurance that they are breastfeeding adequately.
Right. And of course, the country is making significant progress when it comes to sensitizing the country about breastfeeding. I believe in 2005, the rate was at about 13% of women only breastfeeding.
Yes.
But by last year, I believe it was around, was it 60%?
64%.
64%,
yes.
and that's quite high. That's over 50%, which was the target.
Yeah.
And that's a good job. But then there's several initiatives also by the Kenyan government, and one was the baby-friendly hospital initiative, and that was set up to ensure that breastfeeding is done from the time of delivery.
From the time of delivery.
So this is a service that should be offered at every maternity hospital in the country.
Yes.
And so women can be taught on how to breastfeed, the techniques of breastfeeding
through
that.
And we also want to encourage that once you walk into a hospital, then all the system in the hospital are encouraging breastfeeding. This would mean if I walk into a maternity, then there are not options of breastfeed. You know, they have the breast milk substitutes that are normally given. Yeah? So we want to make sure that if you walk into a hospital, those are not the things that you will be seeing in a breastfeeding, in a maternity unit or in a nursery, because normally when babies are born, the nursery is where they will be. So we want to make sure that once that is something that was passed, and it has really helped, because you find that mothers know that once they have delivered, there is no any other alternative.
Right.
They would need to try and calm down, because for you to produce breast milk, there is the element of you being very relaxed. You need to eat well, not necessarily the portions, but what is the nutrition that you're having. So the mother is able to feel comfortable that there are no options, or it is expected that they would produce milk.
Right.
So that support has really helped the mother and they are able to initiate breastfeeding early. Yes.
So it's psychological when you have to breastfeed.
It is psychological, yes.
Right. Now, speaking of that, then how much psychological support are women in Kenya getting, especially those in not just the formal sector, but in the informal sector as well? Because women in the informal sector don't have 3 months maternity leave at all. And, many of them don't have enough money to save for the after birth. So you find them leaving the baby at home and going to spend a whole day in the shamba and leaving their babies at home. So how much more support do we need to give our women?
We need a lot of support, but first what we encourage is the support has to come from the family. The mother needs to feel that the immediate family has really supported them. It could be financial, but there needs to be support on encouraging the mother, such that they're not left alone, and they're the people who have to cater for the children who maybe in terms of preparation of let's say they want to normal house chores. Let me just call them normal house chores. So if the mother is the person who's doing all that and they don't have somebody to assist them, the strain tends to increase. But you tend to find that those mothers, because they are able to cope better, I could say, they're able to cope better. But I think as generally as a government, and those are the people, because what we have found out is non-communicable diseases are really on the rise on the people who are of lower socioeconomic status. And it could be associated with the challenges that they could be having that we do not pick very early, because we feel that they are able to do all this, they are able to do the breastfeeding, and we tend to concentrate so much on the ones who are very well off. So it's important the mother that is, they are taught how to, because you can store milk even when you don't have a refrigerator. You can store milk provided.
How do you do that?
You need a cool place, a very, not a warm and congested place. You need to cover the milk. It can take up to 6 to 7 hours, 6, 7, 8 hours without refrigeration. And if they're able to know, because you don't also need a breastfeeding pump to express. There is a technique that you can use to express the milk. So if they're able to be taught those kind of small concepts, and they are able to feel, it's not necessarily that the others, the ones who have these kind of facilities, are the ones who can do this kind of measures. They can also they can also manage on themselves. So there is a lot of support that they would require. But what I would say is let it start from the family, because once the work and the chores are less, they are able to relax more. If they also need to go and work, they're able to know that they can express, and they can store and come back and still continue breastfeeding.
Right. Let's talk about the formal sector. There's been a lot of calls for corporates to ensure that women have breastfeeding rooms, and for the psychological effect, for them to relax and be able to, some are also asking for, baby care centers, for you just to have peace of mind that your child is well taken care of. But how much progress have we had in the country with that? Because I understand that very few corporates have those facilities.
We would say few, but most have tried to take the initiative. The idea is I think because the last year's breastfeeding week was about breastfeeding and work. So I think between last year and today's and up to today, a few of steps have been taken in terms of also how long should the maternity leave be, how can they extend also their maternity leave as a mother. But it's something that would require a lot of finance, because you're thinking of having such a setup. You would require human resource that are trained, because you don't want to leave your child somewhere and you're not really sure who is taking care of them. So I think because of the resource part, it's something that most institutions have taken up positively, which would encourage that they keep doing that, so that eventually then we are able to have such setups in a way that they can be able to also give the benefits that they are required, because they need to have facilities of storage, they need to have facilities of where do they breastfeed, facilities of privacy, so that the mother also feels confident when they're going into such a facility. So I think it's something that is continual, and I think the response has been positive. A few companies are doing it, and it has really worked for them.
Okay. Now we have a survey here that was done in 2014 that shows that suboptimal breastfeeding results in more than 800,000 deaths per year. And that's something we haven't talked about, the death aspect. So children can succumb to infections and diseases they get as a result of not being breastfed. Tell us about that.
So what happens is we would go to the first point that we started with, immunity of that child. The immunity is in so many aspects, because you're thinking of what affects the children, most of the children, because of having a lower immunity, then it means most of the environment would affect them in terms of the flus that they would get, in terms of respiratory infections that they would have. Most of them would be diarrhea that is uncontrolled, and you find that this because the children are quite they've not really, the body, and they're not able to cope with infections as an adult would, and the resistance is not as much for them. So what happens is they get a small infection that would lead to a lot of losses. A lot of losses in this case would be a diarrhea or a vomit, and those, if they're not able to be taken care of in a health facility that can be able to immediately sort the dehydration aspect, or maybe sort maybe if it's respiratory, in terms of how is that in terms of, if the facility is not able to really help that child from the symptom stage, then the child tends to deteriorate faster. It's not like an adult. So what we find that is, because of that, then mortality is higher generally for children. But you can associate, because that was 2014, the increase in breastfeeding rates that is in our country, that we've it's more than 50%, has really improved, because the mortality rate has also is reduced. We have also found that facilities are closer to the mother. They are able to have get to a health facility faster. And the distance really is it could be a problem to some parts of the country, but most people have really had it easier.
Right.
Yeah.
Right. Okay. So let's speak about baby formula, the nuns and the whatever we use. Many women, of course, don't know that they can reverse their lack of breast milk or their reduced flow, so they supplement with the formula. Does this have any health implications, or is it recommended?
Normally, we say the best that you can give your child is a breast milk, because at the end of the day, it's in the combination that the child would require, the best combination of nutrients and of micronutrients and all the benefits of immunity. But when you're thinking of breast milk substitute, there are so many in the market. But what we would recommend, that the mother needs to know what are they opting to do. They need to be advised, because we have different options, different companies doing the marketing for those products. You need to know what is the indication that you because they are specialized formulas. Others are just general formulas, but you need to know how much do you need to give your child, how do you store, how do you mix the formulation. So what we would recommend also from the health, as a health professional, is that you need to make sure that you're not going to prescribe it for yourself. So that you don't say, I don't have enough milk, and you've not really assessed, do you really have enough milk or not enough milk? Because if you do self-prescription, you may buy something that is not also what your baby would tolerate better. So it's an alternative, I could say, especially when we are in a health setup. It's something that we would recommend, but we would not recommend that you buy as a mother. You just feel, I don't have much, let me go and buy this. We also want to raise awareness on other options that most people would resort to, like cow milk, because they have more adverse effects than the breast milk substitute, in terms of what is the combination of what's the nutrition composition of that cow milk. Other people feel they can do camel milk as the best option. So you find that at the end of the day, you're looking at your child. The child is a small child. You're thinking of calf is a small, it's quite a big structure. Exactly, So the nutrition of that is quite high when you're trying to think of your baby. There are people who would dilute that, but then you find that at the end of the day, you would dilute, the nutrition tends to reduce, but the combination really is not the best for the child. So it's something that we are really trying to encourage the mother, that if you feel that it is not adequate, or you're trying to initiate complementary feeding at 6 months, it's not something that you're opting for, because the combination are not really the best. But the other alternatives, it's really on, it's best when you do it as a prescription. You're taught how to, what's the amount that you can give your child, because a child, depending on the weight, would feed differently. So it's not, when you compare breast milk substitute and the options of milk,
breast milk is best.
Breast milk tends to have, it's like a golden standard for the child.
All right. So let's speak about breastfeeding for women with diseases like HIV. How do they go about breastfeeding, just to say if the child is not infected? How do they prevent that mother-to-child infection?
That's a good question. Because what happens is, once you're because a HIV patient is someone whose immunity is also quite low. So what happens is, a mother there's an assessment that they are done. So we need to know at what level is the immunity. There's some things that we can measure, and we're able to know that how strong is the immunity at that particular time of them starting to breastfeed. Previously, we have had programs that have really encouraged breastfeeding with as a HIV mother, and you're able to be given medication, and the child is also given medication as a prophylaxis, and they're able to really continue breastfeeding until 6 months when they are initiating other complement feeds. But what is encouraged is within the 6 months of you breastfeeding, you're not giving anything else at all. Because what happens if you give anything that is not a breast milk, then you're compromising the child into infection. Yeah, so there is a lot of support that really needs to be given to the mother, because they need to know those aspects. What should I not do? What should I do?
So like for HIV positive mothers, is that information readily available for them in hospitals? How not to infect the child, how to keep feeding the child? Because from the surveys that we're looking at here, I understand also a lot of HIV positive mothers are afraid of breastfeeding their children, and so they resort to other, you know, cow milk, camel milk and whatnot.
Yeah. So this is, information is very available if you're able to walk into a facility that has those services. Especially most of the hospitals are offering that, and the guidelines on how to let's say initiate feeding for a HIV patient, another patient who is who has cancer. You know, those conditions that tend to really distress the immunity. If you walk into a health facility, they're able to give you those alternatives. What can you do? What's the best practice for your child? So what really we are encouraging is that you find that most people don't have that health-seeking behavior. You don't want to go to the hospital and be given an advice. We want to go to the hospital when we really feel sick and we want a medication. So we really want to encourage someone who, if you want to know the best practice, because these are guidelines that have been passed, then you're able to be guided and given the steps on when do you stop, because there is when do you stop, what do you start with, yeah, so that you're able to also give the benefits, the best for maybe the child.
Okay.
Yeah.
Right. So even as we wind up, let's speak about mothers with disabilities. You know, maybe after giving birth, they went through an accident that had them maimed, or they went through a bad ordeal and they can no longer support themselves physically, and they still need to breastfeed their child. If you've encountered cases like that, what kind of support do they need?
I think it would depend with the kind of disability you have encountered, because generally anything that, unless it's something that would affect maybe your limbs, but because your limbs, on the lower limbs, you're able to really continue to breastfeed. Even with the hands, really, you are able to do it, because we have if you come to a facility, you're able to be given those, we call them supports, that can be able to help you support your baby even better.
Right.
But what happens is a mother who has been affected mentally, maybe because of an accident, they're not able to coordinate, or maybe, let me just call it coordinate most of the things. And those are mothers that would need more encouragement, more support. From a hospital setup, if they're coming to the hospital, then the element of expressing is really something that we have tried to really support the mother with, because then they are able to, even if they're not breastfeeding per se, like having the baby to them, then they're able to give that milk, which is giving the baby the benefits that they would require. Right. So it's more on support, how to hold the baby, and more psychological counseling is there in terms of psychological support. And these are services that all can be done in a hospital setup.
Right. All right. Well, thank you so much. Dorcas Gishuhi there, expert nutritionist from the Nairobi Hospital, just giving us more information on the benefits of breastfeeding as the world wraps up the World Breastfeeding Week. And that brings us to the end of the Weekend Express this morning. Thank you so much for watching. My name is Michelle Ngele. Do have a good morning.